Hello, everyone. My name is Sharif Yaqub, and I want to talk to you today about something very important. Life is getting harder, whether it be with prices going up for rent, for gas, for food, utilities. The necessities of life are becoming harder and harder to get. And I believe that things are going to get worse. And that is why I decided to make this series of videos, because if you have diabetes or any other chronic healthcare condition, or if you love somebody or care for someone who has diabetes, or if you are a doctor, nurse practitioner, physician assistant, or any healthcare professional who helps people with diabetes, you need to listen to this series. There are many important changes to our way of life that's coming. And already things are starting to get very hard, especially for patients who have a chronic medical condition like diabetes. My name is Sharif Yaqub. As I said, I am a double board certified endocrinologist in endocrinology and internal medicine. Endocrinology is the field of medicine that deals with hormonal issues such as diabetes, among other things. And in addition to this, I have studied at length economics, history, international relations. And that is why I've come to the conclusion that things are really going to get much worse for most of us living, especially in the West, and times of hardship are coming. Now, I remember in 2007 to 2009, when there was the Great Recession, as it was called, a lot of people with diabetes put their healthcare on the back burner because they were laid off their jobs or didn't have the means to get medications or seek medical care. And so they decided to leave diabetes on the back burner for a period of time. And they thought, well, when things get better, I will then take medication, take care of my diabetes, but now I can't afford it. They ate anything they could get their hands on. They didn't really think about nutrition. They didn't think about medications or taking care of their blood sugar. And as a result, even when things did get better eventually, they suffered a lot of consequences with diabetes that they couldn't reverse. And a lot of people lost their limbs, had lost their eyesight, developed kidney failure, or even died. And that is an unfortunate thing and a tragedy that doesn't need to happen, because it's not either or. It's not either we have the money, the finances, the insurance, and everything is going well, or we leave diabetes on the back burner. We can take care of diabetes on a budget, and I will show you how in this series of videos. So let's begin by asking, what is diabetes? And before I begin, I just want to make two disclaimers. The first one is that my views here do not represent the views of my current employer. And the second disclaimer is that this is going to be a series of videos for mixed audience. So I want to talk to the patients, the people who have diabetes or their relatives, people who care about them. But at the same time, I want to address my colleagues who aim to help and serve people with diabetes. Because it is a mixed audience, some of the things that you will hear may be complicated concepts, but explained in a very simple way. So for the healthcare professionals listening to this, don't assume that it is because there is a mixed audience that is going to be basic or simple. You will learn a lot of things about diabetes that you didn't know before. And for patients, don't assume that it's going to be complex or things are going to be hard to understand, because I'm going to try and make it as plain as possible. So having said that, let's start by asking the question, what is diabetes? Diabetes is a breakdown of the insulin glucose system. What does that mean? Well, let's take each one of those things apart and try to unpack it a little bit. What is glucose? Glucose is the main form of sugar that is needed by the body to produce energy and to make the things that it needs to make, perform the functions that it needs to perform. So for example, Our body is made of organs, as you know. Each one of those organs has small units called the cells. Each of those cells needs glucose in order to function and do the things that it's supposed to do. Now, how does glucose get into the cell where it's supposed to work? Well, there is a hormone called insulin that opens the door, if you will, and lets glucose into the cell. Well, what's a hormone anyway, you ask? A hormone is a messenger. It is a form of a message carrying system to different organs of the body, starting from an organ called endocrine organ. So in other words, it's a messenger. It has a message to deliver. It tells the liver or the muscle or the fat cell to do something specific. In this case, the insulin, being a hormone, is telling the cells to open up the door and let the glucose inside so that it can work and help provide energy for the cell. So what's diabetes again? It's when that system fails, when that system breaks down. Now, there are two main reasons why the system may fail. One is if the insulin is not there or is not there in a sufficient amount to help the glucose get in the cells where it's supposed to get. And of course, as a result, the glucose hangs around in places where it's not supposed to hang around, like the bloodstream. That's why the glucose level will go up in the bloodstream, because it is not going where it's supposed to go, inside of the cell. The second way that the system can break is if the insulin doesn't work the way that it's supposed to work. It doesn't open the door the way that it's supposed to because of the presence of something called insulin resistance. In other words, the door is stuck, if you will. The door to the cell is stuck. It is hard to open. So the body will try to overcome that by making more and more insulin. By the way, you ask where does insulin come from? Well, it comes from the pancreas, which is an organ in your abdomen, in your belly, behind your stomach. So it's deep inside of your belly, and it secretes insulin to let the sugar in, let the glucose inside of the cells. So either a breakdown of the insulin glucose system because there isn't enough insulin, or a breakdown of the system because the body is resisting the action of insulin. Either of those two things will result in diabetes. Now, a lot of people simplify it very much and say, okay, I really understand that type 1 diabetes is where the body doesn't make insulin, and type 2 diabetes is the condition where there is insulin resistance. Is that right? Not exactly. It is true that the main issue with type 1 diabetes is lack of insulin. There isn't enough insulin produced by the pancreas. And it is true that the main problem with type 2 diabetes is that insulin doesn't work the right way, but both conditions can have both aspects. So for example, type 2 diabetes, you do get some degree of insulin deficiency, that the body doesn't produce enough insulin to meet those high demands for it to be present. But also with type 1 diabetes, a lot of people with type 1 diabetes will have some insulin resistance. Now, I know this might sound complicated, but if you take home anything from this, what I want you to know is that insulin is a hormone. It's a messenger that's important to get the sugar inside of the tissues that need it to work and to function, and that this relationship, this system that's supposed to work well in our bodies, doesn't work well in cases of diabetes. And so how we improve that and how we treat that will depend on either making the insulin work better or giving the body more insulin to use. That's in a nutshell. Now, on the next episodes, I'm going to discuss a lot of things that have to do with diabetes, especially how to manage it on a budget, whether it be with nutrition, exercise, physical activity, medications, insulin, getting the healthcare that you need, all of that I'm going to address in future videos, so stay tuned. And if this is something that is important for you or for somebody you care about, please like, share, subscribe to this channel. And until next time, have a great day.